How long is it safe to travel when pregnant? If you're carrying one baby and you've had an uncomplicated pregnancy, then you can fly up to 36 weeks of pregnancy. However, airlines are sometimes unwilling to carry women who are more than 28 weeks pregnant because of the risk of premature labor. Usually, it is safe to travel during the first 8 months of pregnancy. The main concerns with travel during pregnancy are access to medical care, discomfort, getting enough exercise and fluids, and having a healthy diet. If you have any medical or obstetric complications, such as poorly controlled diabetes, placental problems, or pregnancy-induced high blood pressure, your provider might recommend you not travel at any time during your pregnancy. If you plan to travel, discuss the trip with your healthcare provider. Talk about the distance and length of the trip. The mode of travel. Any suggestions for things you should or should not do before, during and after the trip. Generally, the safest time to travel during pregnancy is the second trimester, 13 to 28 weeks. At this time, you probably feel your best and you are in the least danger of having a miscarriage or premature labor. Avoid traveling any long distance during the last 2 or 3 weeks before your due date. If labor starts early, you will want to be close to home. Flying is usually a safe way to travel. Most domestic airlines will allow a pregnant woman to fly up to the 36th week of pregnancy if there are no problems with the pregnancy. Each airline has policies regarding pregnancy and flying. Check with your airline when you reserve your tickets to see if you need to complete any medical forms. You should not travel out of the country without discussing it first with your healthcare provider. Your provider might decide foreign travel is not safe for you. If it is safe, your provider will let you know what should be done before you leave and when you arrive at your destination. You might want to register with an American embassy or consulate after you arrive. It is important to make sure you have had all the shots you need for the countries you are planning to visit. Some immunizations cannot be given to pregnant women. Make sure your health insurance is valid abroad and during pregnancy. Also check that the policy covers a newborn if you were to give birth during your travels. Keep your travel plans as flexible as possible. Problems might develop at the last minute and you might have to cancel your trip. Unless it is absolutely necessary, do not plan any trips during the third trimester of your pregnancy. It's not that you shouldn't travel during the first trimester, but nausea and fatigue can often make it uncomfortable. Miscarriages are also more likely to occur during the first trimester. Air travel doesn't cause miscarriage, but women who miscarry when they travel have a hard time believing it's not their fault. Any significant change in fetal movement could be a sign that the baby is in distress and requires immediate medical attention.